We just saw one of our total ankle replacement patients back, and she is doing really well. We're very, very happy with her progress. Normally, I let people wait there at around week 2 or 3, and she's right on track for that. She's already started physical therapy, in no pain and really handling things well. She's a great patient, but this is a great procedure. So if you have end-stage ankle arthritis, maybe consider a total ankle replacement before you agree to a fusion. Studies have shown that people after total ankle replacements actually do better in terms of activity and pain relief after the case, and have the same rate of reoperation as opposed to ankle fusions. And also, when you get a total ankle replacement, even if you don't regain your full range of motion, you're still able to preserve your hip and knee and low back normal biomechanics. So I just want you to think about total ankle replacement if you have end-stage ankle arthritis, and then think of it as an option to a fusion. You don't have to have a fusion.